Can I start, Rahul?
Yes, sir.
Okay. Very good afternoon, everyone. On behalf of NASH 24 by 7, I welcome you to our public awareness program on FAQs on management of NAFLD and NASH. NASH 24 by 7 aspires to bring best-in-class education and awareness program to serve healthcare workers, patients, and their caregivers. Today, we have the renowned gastroenterologist from the Prayagraj, Dr. Alok Mishra. He needs no introduction. However, I would fail my duty if I don't mention that. Dr. Alok Mishra is a leading gastro in Prayagraj, providing the comprehensive and the compensatory care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient-centric care. He is currently associated with ACA Gastro Care and Multi-Speciality Hospital as a senior consultant. Sir, we salute your dedication to spreading awareness related to liver health. So now I invite Dr. Alok Mishra to enlighten us on the topic. Sir, over to you.
Very good afternoon. I'm really glad to share this PPT and this talk on non-alcoholic fatty liver disease to my audience because it's a very important disease. Because we know that fatty liver is so common in India, and everybody who is going for ultrasound having some symptoms, you will at least one-third of person in India, healthy population, those who see the general population, if you screen on ultrasound, you will find that there is a fatty liver. And many of the persons will are having some queries and they are apprehensive, what is this fatty liver? Because you know the liver is the second largest organ. It is located in right upper quadrant of abdomen. It is covered with a rib cage. And it has very important functions. It is one of the largest gland, you can say. It produces bile, it detox blood, it is involved in the metabolism of the fat, proteins, minerals, and of course, all metabolic activities are being governed by this liver. So it's a very important organs. Non-alcoholic fatty liver disease means when the liver is having significant amount of fat. Of course, there is some amount of fat always in the liver, normal liver, but if it goes beyond the 10% of the cells, then it is considered to be important. It can produce the problem with the liver. So, non-alcoholic fatty liver disease, it is basically spectrum. When you have fat in liver, it is a fatty liver. When you have beyond the fat, there is inflammation, there is a fibrosis, there is cirrhosis. So you can have disease of spectrum. And this disease basically occurs because you have overweight, obese, or you have diabetes, hypertension, cholesterol is high. So all these risk factors lead to, and insulin resistance lead to fat deposition in liver. And once fat deposition in liver occurs beyond the certain limit, then it produces the inflammation. You can say Susan, that is a non-alcoholic steatohepatitis. And beyond that, there is a fibrosis, and then you have cirrhosis, and you can have liver cell carcinoma, that is hepatocellular carcinoma. So non-alcoholic fatty liver is an important disease which can lead to simple from fatty liver to cirrhosis, decompensated cirrhosis, even liver cell cancer. How common is this fatty liver? As I have already told you, if you screen general population in India, one-third person will have fatty liver on ultrasound. If you screen diabetes or obese or patient having high cholesterol, about 50 to 60% will have fatty liver. Apart from fatty liver, different spectrum of fatty liver, but it's simple, significant amount of fat is there. You can have fatty liver. Very significant amount of people. You can see one-third of our population and half of the population who is having diabetes or obesity, they are having this fatty liver. And those who are a significant amount of fat, they can progress to inflammation, that is steatohepatitis, and then go to fibrosis. So this is the spectrum. When you have healthy liver, you have fatty liver. Once there is inflammation, it can have fibrosis, and fibrosis ultimately go to have the cirrhosis, in which liver is being permanently damaged, shrunken, irregular, and its functions start deteriorating. So there's two important things: fatty liver with inflammation or without inflammation. Inflammation means when there is some inflammatory cells inside the liver. There is only the fat is there, no inflammation, it is a benign disease. But the fat is there, and if there is inflammation, that leads to significant amount of injury, fibrosis, and then cirrhosis and hepatocellular carcinoma. So inflammation is very bad thing for liver. Only simple fat is relatively, you can say it is not that bad, but once fat is there and inflammation, that is NASH, NASH is there, it is a problem, and that can lead to progressive liver disease. Why this occurs? It is basically two things: host factor and environmental factors. You have genetic background, but most important thing is your lifestyle. When there is sedentary life, your obesity, you are having diabetes, you are having hypertension, you are having, as we have said, physical inactivity, and of course, some amount of drugs and viral infection can also lead to fat. But when we talk of NASH or NAFLD, it is basically lifestyle problem. When there is obesity, hypertension, diabetes, triglycerides, dyslipidemia, that can lead to fat accumulation and inflammation in the liver, and that is an NAFLD or NASH. As we have said, that obesity is rapidly increasing in our society. Children are becoming obese. Of course, our population is becoming, you see that 30, 40 years of age, 30, 40 years back before, people are lean and thin, but now they are having more obesities spreading in our country, even our society. And this is basically because of more of carbohydrates, more of saturated fats, and less of inactivity. So our lifestyle is changing, and so obesity is becoming more common, and so the liver disease is also spreading. Diabetes is a very important risk factor for fatty liver disease. And what are the symptoms? If you say symptoms, they are usually non-specific symptoms, and majority of the people will not have any symptoms. Basically, they go for an investigation for some sort of non-specific symptom, like some amount of distension of abdomen. They say there is some discomfort, some fatigue. So they are initial symptoms, and when they go for investigation, you do ultrasound or liver function test, then you found there is abnormality in liver in the form of brightness on ultrasound, that is a fatty liver, or you see the increased GPT-OT elevation, that is hepatitis. But if disease progresses, simple from NAFLD or NASH, when it goes to advanced fibrosis and cirrhosis, then you will have serious symptoms like swelling over the limbs, that is pedal edema, fluid in the abdomen, that is ascites, then you can have jaundice, you can have bleeding, you can have altered sensory, that is hepatic encephalopathy, or you can have liver cell failure. But this is the extreme end, when the liver start failing. These are the very bad symptoms, and it is a stage when you have no point of returning back. But before that, mild symptoms, non-specific symptoms, even asymptomatic patients, if you do a routine screening, you can pick up non-alcoholic fatty liver disease or NASH. So minor symptoms, non-specific symptoms are usually in the early part of disease. And how you pick up this disease, as I have already told you, majority of the time it is routine ultrasound. You went for ultrasonologist for some other problem, and ultrasonologist reported a ecogenic liver, fatty liver. Or if you go for some other health screening, you found in the liver function, there is GPT-OTI, AST-LT are elevated. So this is the most important, these are the two most important modalities by which usually in general population, NAFLD is picked up. Apart from once it is picked up, then you can have other specific investigations, liver biopsy. You have fibroscan, which can pick up the fat content and fibrosis non-invasively. You can have CT, you can have MR, and there's lots of tests are there. But these are the advanced tests where the specialist recommends. But routine in population, it is a routine blood test or ultrasound that pick up the non-alcoholic fatty liver. There is a raised ALTS, that is SGPTOT. Many of the people see that their liver function test during health screening, they found some abnormality in their SGPTOT, that is the liver function test. SGPTOT simply says there is an injury in the liver. So if there is hepatitis, then their SGPTOT is elevated. So you can say that is a NASH. But not necessarily all NASH patient will have raised SGPTOT. If their SGPTOT is elevated, yes, there is a NASH. But you can have NASH even the SGPTOT is normal. So you cannot be very sure that your liver function is normal, then your liver is healthy. No. But definitely those who are having a raised SGPTOT, they are having the progressive disease and they can progress to fibrosis and cirrhosis. But as we have known, 80% of NAFLD patient can have normal SGPT. So simply having a normal SGPTOT, you are not sure that your liver is absolutely normal. So how will you know your liver is normal or your liver is having inflammation? So there are several scores like FIB4, APRI, NAFLD fibrosis score based on age, SGPT, OT, platelet, BMI, sugar. So there are several scores are there which can predict you the hepatitis element of the NAFLD, that is a NASH. And you must know that when you are talking of NASH or non-alcoholic fatty liver, there are three components. One is fat, another is inflammation, and third is fibrosis. Earliest is the fat. When there is inflammation, there is hepatitis, that is a NASH. Once there is a fibrosis, then there is a NASH with fibrosis, and fourth is the cirrhosis. So stage goes from simple fatty liver, it goes to inflammation, that is a NASH, then go for fibrosis. Ultrasound will detect you simple fat. For detection of fat, ultrasound, you can have fibroscan machine, it can detect you by CAP. You can have CT or MR, by which you can also detect the fat. Ultrasound detects fat when there is more than 1/3 of liver is involved. And also it cannot quantify. You can have, if you have see the your ultrasound report says grade 1, grade 2, grade 3 fatty liver, but it is a very crude. If you go for fibroscan test, it can very easily quantify. Generally, you can see this is 198. This is a CAP value. And this LSM, this is fibrosis. This value measure the fat content in the cells, and this measure the fibrosis. Generally speaking, if it is less than 275, 280, then the fat is insignificant. It's less than 10%. But more than 275, it is a significant fat that is more than 30%. And if it goes beyond 300, 350, that means a severe fatty liver, that is more than 80 to 90% liver cells is having fat. So CAP gives you estimate of fat in the cells, and there is LSM. It gives a fibrosis. And LSM less than 8% says small or minimal fibrosis. And if it is more than 14 or 13, it gives you that it is having significant fibrosis, means cirrhosis. So anything below 8, of course, it is reversible. You can be still sure that your liver is still not very bad. But if it goes beyond 8, that means the fibrosis, that is scarring has started in your liver. Then the scarring will lead to ultimately failure of the liver. So anything beyond 8, it's worrisome. And anything beyond 14 This LSM means your liver is now it's having cirrhosis, and you need to be very cautious about this disease. And you have several machines like transit elastography. Again, you can have MRI, but these are not easily available. They are costly, but of course, they are more sensitive and more specific in quantification. You can do liver biopsy by, you can have that small needle through skin, it goes into the liver. It can take out a small piece of your liver. It's a gold standard for steatohepatitis and fibrosis and cirrhosis, but of course it's invasive, and in India it is routinely being not done because of lack of acceptance of invasive procedure by population, and of course safety purposes. So liver biopsy, though, is the gold standard, but routine clinical practice, it is not being used because of some risk of complications and being invasive. Of course, NAFLD to cirrhosis, it takes several years. Like you have NAFLD, you can do NASH, fibrosis, cirrhosis, then decompensated in HCC. So it takes several years, but of course, at every stage, you have to be measured, and you have to go back, you have to make interventions so that you may not progress to cirrhosis. From here, you can go back. So as I've said, it is too late if you intervene at the stage of fibrosis or cirrhosis. Better to intervene at the level of fatty liver or early NASH. Oh, of course, if you have advanced liver disease, you should talk to your liver specialist. But the basic treatment still remains intervention in the form of diet, where you can have more of fibers, legumes, less of fat, especially trans fat, more of proteins, less of carbohydrate. You have to do exercise. Exercise means you have to reduce your weight. And of course, it has been seen that exercise without reducing weight, it improves your liver histology. And exercise should be in the form of at least 200 minutes per week, 30 to 40 minutes of aerobic exercise per day, at least 5 days per even. And it should be moderate in intensity. How do you know it is a moderate intensity? If you do some exercise aerobics, if you're doing exercise and you're talking regularly without any pause, that means your exercise intensity is nothing. If you're doing exercise and if you can have some conversation with a small pause, it is a moderate exercise. And if you do exercise and you cannot tell a single sentence without interruption, that means you cannot talk properly. That means you are having intensity of exercise is much more. So if you are having your daily routine morning walk and still you can talk with your friend routinely, it's not going to help. Your intense exercise should be such intense that you cannot complete a one sentence without taking the rest. Number one, your heart rate should increase and you feel tired at your muscles. So at intensity of exercise is much more. And of course, in aerobics, they said it should be HIIT, like high intensity intermittent exercise. Like you're having the walk and in between, you should have intense sprint in between so that you can have exercise. Otherwise, your exercise is of no use. Of course, you have to cut down smoking, alcohol, saturated fats, processed food, and of course, medication not with only after consultation with your consultant. And diet should be of what type of diet? Like it is more important the calorie of the diet rather than the type of diet. Whatever diet you are having, you should have that diet, but cut down on the size of your meals. Cut down your diet. You should have the same diet. Calories should be cut down. At least 30 to 30% calories should be cut down. Fat should be cut down. Carbohydrate should be cut down. And you should have lose at least 7 to 10% of weight to have a significant improvement in liver histology. So weight loss effect, you see, if you lose more weight, you will have more improvement in liver histology. So at least 10% of weight loss to improve the fibrosis. This is known as Mediterranean diet, but it is not practical for Indian conditions. But the basic thing is you should have your routine diet. That amount should be curtailed, fat should be curtailed. You should have more leafy vegetables, fruits, legumes. You rarely should have processed food, red meat. Fish, yes, you can take, but mainly should be vegetable diets and with less of trans fat or saturated fat. Exercise, as we have already said, that aerobic exercises is very good. It should be done. Resistance exercises, they can supplement, but the main emphasis should be in aerobic exercises. So if you do dieting, fatty liver will revert back to normal. So basic thing is you have to improve your lifestyle. You have to modify your lifestyle, improve your diet, improve your exercise, and then you can reduce the fat, you can improve your liver histology. So it's basically lifestyle disease where your basic treatment, everything's progression of liver disease depends on lifestyle. And what about the drugs? There are several drugs are available which can have pharmacotherapy, but this pharmacotherapy should not be used without consulting your consultant. And of course, for public, the main thing is still remains diet, lifestyle, and exercise. This is the basic message you should gain, and you should control your liver, make your liver healthy by simple lifestyle modification. And it is still 80 to 90% time, lifestyle modification, diet and exercise helps you rather than drugs. Drugs are available, but they are effective. Any questions?
Thank you, sir. Thank you, sir, for this wonderful talk. This is enlightened us. Now we will take the question from our audience, with your permission, sir. Sir, there is a common question is asked by the audience is that how is the difference between the NASH and fatty liver, sir?
As I've said, the fatty liver means that the fat in the liver. And there is always stages. Initially only fat, when there is inflammation, then there is a NASH. Fatty liver and NASH, to differentiate fatty liver and NASH, as I have said, that if your SGPTOT is elevated, it is indicator of the NASH. But of course, I've said many of the time you will have the NASH, but still SGPTOT is not elevated. So marker of this raise SGPTOT, and other markers scores are there. So that can tell you, like CAP is a very important marker in fibroscan. It is a parameter. If you have fibroscan, is just like ultrasound machine. So a small amount, it uses sound waves. Just like ultrasound, you put the probe over liver, and it gives you parameters like CAP and LSM. It's a very easy operate. It is not a cumbersome procedure. It's not a procedure where you need a very trained technician, but it's a simple technician-driven investigation, very easy. And within 5 minutes, it gives you CAP and LSM. CAP is indicator of fat, and LSM is indicator of fibrosis. To see the inflammation, definitely you have to inflammation, you have to do SGPTOT and other platelet, APRI score, FAB score, several scores are there. So to have the NASH, you need to have inflammation in the liver, which is difficult to assess apart from blood test. And of course, 100% surety is liver biopsy.
Sir, there is a one audience, Mr. Mukesh is asking is that I am not consuming the alcohol, but do I have chances to have a NASH?
Of course, the NASH means non-alcoholic fatty liver. Means this liver disease occurs in absence of alcohol. Definitely, it is a definition itself tells you are not having the alcohol, but still you can have the liver disease. And the cause of liver disease is obesity, that means overweight, diabetes, hypertension, dyslipidemia, more cholesterol, and your lifestyle. This is basically lifestyle and obesity related problem, metabolic syndrome related problem. It is not related to alcohol. Definition itself says you should not have the history of alcohol. You can get that NAFLD in absence of alcohol.
There is a one more question is that what is the recommendation for the exercise in the NASH, sir?
Exercise and diet. These are the two basic intervention for treatment of NASH or NAFLD. And exercise, without these two, dietary modification and exercise, no treatment is in NASH and NAFLD, because the aim is to reduce your weight, aim is to reduce the sugar, aim is to reduce the cholesterol. Exercise is a mainstay. Exercise, you have two aims: to reduce the weight and to improve the insulin resistance. Even if you do exercise, there is a subset of lean NASH where you are not very obese, but still exercise is recommended, because exercise reduces your insulin resistance. So exercise improves the liver histology. As I have told you, at least 200 minutes of exercise per week. 200 minutes per week. That means 30 to 40 minutes per day, number one. And it should be aerobic exercises and moderately intense exercise, not walking sedentarily, gradually. You have to be a brisk walker, jogging. And if you are not having any problem, like in joint problem, back problem, where you cannot do aerobic exercises, then you can go for muscle strengthening exercise. So exercise is very important, and without exercise, you cannot treat NASH or NAFLD. You have to do exercise.
Sir, are there any available medicine for NASH, and is it a curable?
Early stage NAFLD is curable. Cure, but the cure is in the hands of the patient only, because he has to curtail his diet, he has to modify his diet, he has to increase his exercise, he has to improve his lifestyle. So 2/3 of treatment depends on the patient's compliance and patient's motivation. Only 1/3 is the drugs, and drugs are still not a very few good drugs are available, and they are not the first line of treatment. Drugs are available. Drugs are available to reduce the weight. Drugs are available for certain subsets of the patients, but they are not the mainstay of the therapy. Mainstay still remains the same: the diet and exercise. And it is reversal in early phase.
Yes, sir. You're right, sir. So, sir, on behalf of NASH 24/7, I thank Dr. Alok Mishra for this lively and informative talk. As you have been emphasizing the awareness for liver health and disease, it is equally important for people affected by fatty liver to regularly visit doctors and continue medication. With careful observation and precaution, it is possible to obtain the control of the disease. I would also like to thank our audience for their active participation and patience to making this event successful. So, thank you, sir. And I would request everyone stay connected with the 24/7 on Facebook and take care of yourself and your family members. Thank you, sir. Thank you, Alok, sir, for your wonderful interactive talk, sir. Thank you, sir.
Thank you.